Good morning, everybody. Welcome to MedTech Innovators webinar. Hi, everybody, MedTech Innovator Live. I'm Paul Grand, CEO of MedTech Innovator. This is the first in our webinar series, MedTech Innovator Live, that we will be doing this summer. We'll be running weekly webinars that are going to be broadcast to the public. Some of those are private, some of those are public. This first video is our public video. We're very excited to have a great discussion today about producing 1-minute videos. This is one of the topics that's near and dear to my heart. The 1-minute videos are a hallmark of MedTech Innovators program. For those of you who don't know MedTech Innovator, we run an accelerator and a competition that runs throughout the course of the year. We do a big build-up where we meet lots of companies on the road. I'll be mentioning that a little more later. And in the process, we have companies do 1-minute pitches. And as part of our actual program, we have companies produce 1-minute videos. So today's discussion is going to be to talk about the 1-minute video. Some people refer to them as 1-minute pitch videos. But basically, the idea is that these are 1 minute to tell your story, to connect with viewers. We have a number of different contexts for this videos, which I'll talk about in a little bit. But the idea in general is that we have a 1-minute video that is an asset that companies can use not only as part of our competition, but more importantly, for their entire future. So this is something that you can use as a calling card, something you can send out to people just to give them a little bit of a taste about your company. We find that a lot of our startups put their videos right on their homepage. We hear feedback all the time from participants in MedTech Innovator Accelerator and Showcase program that the video was the best asset they've ever created, besides their product. So that's an important thing. It's a great testimonial. This is our 7th year doing these videos, and we've done them for every single one of our competitions. It's something that, without a doubt, as I mentioned, it will be one of your greatest assets. So I'm really excited to tell you about a little bit about videos, what goes into making them, and show you some of the ones that we have from the past. We'll also be joined by Panelist, who will be helping to talk a little bit about storytelling and some of the other things that, in general, go into making good videos. So with that, I'm going to start off a little bit right here and give a little bit of context before I introduce our panelist. So the important thing is that the video is an asset that anyone can use at any time to promote their company. As I mentioned before, it's something that we use in our competition. And so to set things up before I introduce our panelist, I'm just going to talk briefly about the context for this video. So the video this year, and in every year that we have in MedTech Innovator, the video is an asset that we use to basically introduce companies during the conference that we have at the end of the program. So that's AdvaMed's MedTech conference. This year it'll be in Boston, September 23rd through 25th. And we have a showcase during that conference that will be for 2 days. The showcase will have panel sessions, and each panel session is really, as I described, it's a panel. So people are sitting on sofas, and there's a moderator who's asking them questions. It's not something where you're getting up and showing slides. So in order to give people the opportunity to introduce their company and tell their story, we show a 1-minute video before each of the panelists speak. So that's a great opportunity for you to get a chance to tell your story in a way that's very concise, that's very tight. As I mentioned, all of the companies who've been in the MedTech Innovator Road Tour that led up to this point, all of those companies had to do a 1-minute pitch. And that's something that I know a lot of them practice very carefully. They got up and gave a 1-minute rehearsed pitch with 1 slide behind them. And they did a great job. The advantage of video and producing a video over the 1-minute pitch that they do live over the single slide is that this gives you an opportunity to tell your story in a very visual way, and to show patience and do all sorts of things that you can't do in that 1-minute live pitch. So this is a great opportunity, as I said, to kind of concisely practice telling your story. They're very structured, they're very purposeful, And there's something that when we've done them, we've always counseled people that this is your opportunity to let people connect with you as a company, to actually meet you, to get to know you, and just a little slice of you and what you're about, get to know a little slice of what your product is about. And of course, in general, to have a chance to understand the impact that your technology can have on the market. We like them to be timeless, so I'll talk a little more in detail about that as we go, but the idea is that these assets are timeless and something that you can keep on your website using your marketing materials. I can tell you as an investor, people's attention spans are constantly getting shorter, and this is a great asset and a way to basically introduce yourself to people in a way that they can do very quickly. So with that, I'm going to introduce our panelists for today. John Weiser. I'm sorry? All right. Yeah, no, he's on. I'm just going to unmute John. John, can you hear me?
Yes. Can you hear me, Paul?
I can hear you. There's a little bit of an echo. Make sure, let's see. I'll make sure that you're not echoing. Hold on. I think I can hear you, John, although you seem to be frozen. We'll give that a second. There you go, John. Still echoing a little bit.
I don't.
All right, John. I'm going to mute on my end, and I'm going to let John. I'll let you introduce yourself. Give us a brief introduction. Tell us who you are, do for a job.
Thank you, Paul. So what I do for a job is that I'm currently president of production at Sony Pictures and overseeing the TV show production, a bunch of shows. And then I was formerly, before this job, president of distribution for the studio. So sales for all of our films that we release and all of our television series. And part of my job here has been to train the global sales teams, products, and different types of pitches and help coach them. And in the process, have negotiated about $15 billion in deals.
Well, it sounds like somebody I want to have on my corner. So
glad to have you
here. So John, I know one of the things that you enjoy doing personally is you're very involved in Shark Tank. Obviously, it's one of your, one of the Sony shows, but also you're involved in coaching. So maybe tell us a little bit about Shark Tank and just in general, kind of what that experience is like, what goes into making a great Shark Tank pitch. So tell us a little bit about that.
Thank you, Paul. In general, the Shark Tank experience, just to kind of share with you a bird's eye view, is when we do casting, we have tens of thousands of applicants and very few slots in terms of how many people we can show. So it really comes down to a selection process, identical or parallel to the one we're all going through here at MedTech Innovators. So entrepreneurs come in. They usually have really good product and really aren't very good at pitching, or they would have raised money at some time earlier from everyone they knew that they told their story to. So when they come into Shark Tank, we have a line of producers, the entrepreneurs pitch. We listen to what their organic pitch is, and then we get back to them on experienced feedback based on seeing thousands of these entrepreneurs come through of what gets an investor's attention. And then we give them pitch coaching specifically on structure. And on Shark Tank, it's always how much you're asking for what percent of your company. And then after that, it's a little bit more freeform. But it really comes down to you need to have a short story about why you're there that will connect with the buyers emotionally and get them to want to invest. And today, as we're building these 1-minute pitches, we've got to come up with the ingredients that are going to make you successful. And what I've certainly seen on Shark Tank and in sales coaching, when we prepare people to go out, present all of this, is there's about 5 main ingredients to making a killer pitch. Those are, in no particular order, passion. You have to be so passionate about your idea, because passion is contagious. So you really want to be demonstrate just how much you believe in your idea. You want to have confidence, not cockiness, but confidence that you're sure you have solved a problem in the world, and your product is what solves it. You need expertise. So talking about yourself at whatever length about why you're qualified to have built or created the solution to the problem you're there to talk about. You need to connect with people emotionally, and part of that is passion, and part is some other techniques. And what could be the stir stick to all of this is practice, practice, practice. You cannot over practice, because you want to own the material so much that you can just talk about it casually, but with great level of expertise. And those would be the 5 big ingredients in a pitch book.
So you say tens of thousands of applicants, which is kind of incredible. I'm muting you for a second, John. So I will unmute you, I promise, momentarily, so we can get rid of that echo. But tens of thousands of applicants, and you mentioned that you guys go through and you coach the companies, and you talked a little about what's involved in the killer pitch. As you go through that process, do you ever have a company where you've given them all that coaching, and they just don't listen to it, and you sit there afterwards and you go kind of like, God, I wish these guys had taken my advice. I didn't take your advice, and it doesn't go well for them. Like, do you see that a lot, or are these people pretty receptive to the coaching?
In general, people are very receptive to the coaching and realize this is just an area that they're not experts in. Most of them are great inventors or visionaries, or, in our business, it's producers, because they're able to organize people that are great inventors and creators and innovators. But the people that don't take our advice are still welcome to go in and pitch, but you're pitching the casting directors when you get past the producers. So if you can get past the casting directors with a pitch that's unusual, good for you. We just know how to dramatically increase the likelihood that an investor is going to want to step up and write a check for you. So we take those proven principles through our experience of doing this hundreds and hundreds of times and share that with the entrepreneurs. Quite often, they'll take the advice and be successful. And sometimes they just have such passion or focus on the way they want to tell their story. Sometimes they get through, and sometimes they get funded.
All right, I like it. By the way, if you happen to have headphones there, John, that might help with the feedback problem. So I'll let you look for that for 1 second. Okay, so getting into this, John, and I've just slightly muted you for a moment, maybe completely muted you. So giving a little context for today's discussion. So while we're going through this advice today, one of the things I'm going to do is I'm going to play a bunch of videos, and those videos will give us some context, so we can look at videos from the last year's competitors, and we can do a little commentary on that. So that'll be something that's nice and fresh with last year's videos. Before we get into that, one of the things I wanted to talk about before we see the videos is emotion, because I know that's something that you're very big on, John, is emotion. And so maybe you could just briefly talk about like how you create a connection, how you coach people to connect with an audience, and convey emotion.
It's what we talked about a little earlier, which is that passion, confidence, expertise are all contagious. When you're listening to somebody who really believes in what they're talking to you about and has a very specific story to tell, you're likely to pick up on that energy in a positive way. There are things you can do specifically, like when you have your pitch written and it's only a minute long, but really wordsmith very carefully your pitch that you're going to give verbally that is written down so that you can practice. Every single word needs to be important enough to make it into your 1 minute pitch. So your job is to write this great pitch and then, like a butcher, marbling steak, cut out every word that doesn't belong in that plate, so you're just left with a filet mignon. You have to pay attention to, and the best way to do this is film yourself repeatedly. Just take your iPhone out and film yourself. See what you look like when you're giving a pitch. Most people are surprised by how hunched over they are, by how unanimated they are, and how passionless, because they're so focused and uptight about giving the pitch, they're not self-aware. So what you need to pay attention to, very important, because 70% plus of communication is nonverbal, which is what's your body language? And what are your facial expressions that accompany your word? What are you doing with your hands? None of this should be left up to chance. You need to film yourself or tape yourself on your iPhone or your Android and watch yourself and be very honest about critiquing yourself, and let other people look at you and give you feedback. This is the time that you want all of your bad feedback, because it will be constructive to get you ready, but you don't want to come off giving your pitch and have people go, wow, I kind of like the idea, but that presenter sucked. It's your responsibility to be fun, energetic, entertaining, positive, passionate, focused, and have a level of expertise in your video. And the best way to do that is look into a mirror and really judge yourself objectively.
You know, you mentioned something else as well a moment ago, which is expertise. And one of the things I know that we've seen companies do very successfully, in addition to themselves being experts, is that they bring in experts from the outside. And that's something that we've found quite a bit really helps, to have someone who's not the founder, someone who doesn't have stock in the company, have them actually be on camera talking about the patients, talking about the impact this can have, you know, lending their credibility to your device, to your company, to your mission. That can be very effective. I don't know if that's something they do on Shark Tank or not, if they bring other people, but it's something we can certainly do in our videos. So it's something that we like to see.
Generally work as a resource on Shark Tank, because we're really, so often the investors simply bet on the entrepreneur, followed by the product, because they really believe in the entrepreneur. But generally speaking, from a marketing and advertising standpoint, testimonials are the single strongest form of marketing a product, is having other people validate. So if you have not a random person or a patient, as much as a healthcare provider who's able to vouch for this and see the difference, whether it helps that hospital's financials, whether it's focused on how many patients improve quicker, whatever your metric is, having somebody that can validate what you're saying and double down on it will prove to be an area of strength for your pitch.
Excellent. Well, thank you for some of that background context. What I'm going to do now, John, is take a moment, and I'm going to play one of the videos from last year. And I don't know if you were looking for headsets, if you had a headphone around, spare one. You don't have one. Okay, cool. We will go with a little bit of echo, and that's kind of a cool take anyway. It's just a nice echo chamber. So I'm going to play one of these videos, and then we can talk about it a little bit. So so give me a moment here, and I'm going to go ahead and do that. So what I'm going to play for you is a video from last year. What I wanted to tell everybody too is that what you're looking at the moment is probably a close-up on or a big screen. What you're looking at here should be the MedTech Innovator showcase page for the videos from last year's $10,000 Best Video Competition. There's 50 videos on this page. This is MedTech Innovator's website. Then you go under the showcase tab at the top, and the last of the little sub-nav item says 2018 Showcase Company Videos. If you were to scroll down on that, you'll see the 50 or so videos from last year. The first one I'm going to play is from the company that actually won the Best Video Award last year. So that'll give us a little bit of context for what at least some people thought was a great video. I'm going full screen. Hopefully that will work over here, and the video will be full screen. So I'm going to go ahead and play that video.
Every year, there are over 500,000 trauma patients that are at risk of developing acute compartment syndrome. High energy trauma causes swelling to build up within the muscle. If it is not diagnosed and operated on within 6 hours, they are at risk of having permanent muscle and nerve damage. 12 hours, and it can lead to amputation. MyO1 is the first and only reliable solution that quickly, safely, and effectively diagnoses ACS within hours of the trauma.
For my whole career, I've been bothered by the fact that we don't have a good diagnostic tool for acute compartment syndrome. This problem is seen in every emergency room around the world every day. As a trauma surgeon, we rely way too heavily on subjective patient outcomes like pain. We end up operating on way too many patients in order to avoid missing a few cases.
We made MyO1 to solve that problem. We wanted to translate the technology behind MyO1 into a device that was simple, reliable, and easy to use. MyO1 measures perfusion pressure by placing a small sensor within the muscle, similar to the way an IV is applied. MyO1 quantifies the amount of swelling and relays the data to a cloud-based mobile app, giving the physicians a source they can use when deciding when to intervene. MyO1 is a simple solution to a dangerous problem.
All right, so hopefully that was full screen for everybody. Maybe somebody in the chat can tell me if it wasn't. But I'm going to go ahead and unmute John well in a second here, John, so stand by. I was just going to say some of my highlights, takeaways from that. I really love that they started off with the problem, that they gave us kind of a cool animation to show us the problem. And it's one that, most people have never heard of before, which is acute compartment syndrome. So, so I think that's something that, I think is always a problem kind of in our business, is that a lot of the diseases that we're talking about aren't so straightforward. They're more nuanced. And so at least to give people a little bit of a view into what you're talking about here, I think is important. It's a disease, but obviously you only have a couple seconds to do that. So I thought they did a good job with that in the beginning. And I definitely liked that there was a voiceover by the CEO himself, which is really great, that it wasn't a voiceover by a professional person, that it was the CEO, and we got to meet the CEO a little bit after that. I love that the solution actually showed the product. I thought that was really great. And it wasn't just a rendering. It wasn't just an animation. It was the actual product. And I really like that we had a chance to meet the team. I'm going to pause there for a second and unmute John, so you can give me a little bit of commentary too, John.
I agree with everything you said, Paul.
How easy was that?
Additionally, I think when you're looking at creating a structure for these pitches, and this video does a great job with it, you really want to answer what, why, and who, and how. Those really 4 questions, which is, what's the problem? In this video, they start by identifying what's the size of the market before they get to the problem, which is also a good thing. But it's what's the size of the market, what's the problem in the market. The second step is, sorry for the feedback. The second step is, once you've identified the problem, what's the solve for the problem? And why is it a good solve? And what's the product specifically, which this video did. So it's, what's the size of the market? What's the problem? How do you solve the problem? What's the specific product? And why are you qualified? Why should I trust you? What's your expertise of bringing me this product? Because even if it's a great idea, are you capable of delivering it? And I think those are all the key elements to convince somebody that you have the ability to deliver a solution that doesn't exist through your product.
Excellent. Thank you, John. It's interesting, the solution, this particular video, you talked about structure. And, I always take notes kind of on the video and the overall structure, and try and get a sense of what it is that, the company has laid out. What are the key elements of that video? And this video started off with the problem, then they told us the solution, then they talked about the team. So they gave us a little bit about the team. You got to meet the surgeon, got to meet the co-founder too, which I thought was really cool. But then the surgeon kind of came back with the problem again. So he kind of readdressed the problem a second time and then told you about the solution again. And I don't know if you noticed, but this video was 1 minute and 20 seconds long. We strive for these things to be as close to 1 minute as possible. And this one went a little long. They could have cut out they could have cut out either in the beginning, the intro, or the surgeon restating the problem, and it still would have been just as effective. So you don't need to tell you the problem twice in the video. You don't need to do that. But again, this video won the best video competition for a reason. It was a great video. But sometimes it's not necessary to tell that problem and solution twice, but that's what they did. But I do like that they showed also the key features of the product. They showed how it worked. And they also showed it in a patient, which is something that I feel very strongly about. I want to connect with the fact that there is a patient. I think they definitely had a little more emphasis in this video on connecting with the team than the patient, because the patients were kind of anonymous and certainly didn't really look sick, but that's fine. But that was something that I think was effective in terms of connecting with the team. I really did kind of bond with the team from this. And then lastly, I kind of like that they took the value proposition part of this really strongly to heart, and they talked about the value to the surgeon and to the patient, or to not just the surgeon, to the physician, I should say, and the patient. So as stakeholders, they told us who the stakeholders were and what the value proposition for those people were. So I loved all of it, and I also love they had the tagline about the end. At the end, they ended with the tagline that this was a simple solution to a dangerous problem. Which I really like when people throw in a tagline if they can, if it's effective, because that's part of one of the things that John, you talk about all the time, that being memorable. So that's it for the first video. As I said, also would love to see people keep them as close to 1 minute as possible. So that was the first one I wanted to show you. I'm going to bring up the second one, which is a little bit different, and this is from Tasso. So I'm going to go ahead and play that one.
Blood collection today is a terrible process. You have to drive through traffic and then sit and wait your turn for a needle stick, and nobody likes needles. Tasso has replaced that with one device that we send to you. Simply place it on your arm, press the button, and send it back for test results. We center the diagnostic process around the patient, while ensuring our samples integrate with existing lab infrastructure. Our flexible platform means that we can support nearly all of the blood tests people need to stay on top of their health. Blood collection made simple. That's our promise.
All right, so that was a very different video maybe than the first one, had a different feel, different emotion to it. John, maybe I'll start off and let you tell us some of your thoughts about it, and then I'll make some comments.
Thank you, Paul. I like this video a lot. It's very well constructed. It's very carefully constructed, and it's really emotional storytelling about what people don't like to do and how easy it is to solve with this device. If you think about the biggest advertiser in the world, we'll just pluck one out, which is like McDonald's, and you think about how a Happy Meal is advertised. Happy Meal never says in any of their commercials that they're selling hamburgers and French fries and toys and maps in a box. They just show a family and how happy they are sitting around the box. And everyone, the parents and the kids, are equally happy. So what they're selling you at McDonald's is the opportunity to be happy. They're not selling you bad meat and old fries. They're selling you an emotion. And this video does a very good job of selling patients through their healthcare provider a happiness, a relief from the pain in the neck it is to sit in aggravating traffic and get stuck with multiple needles, and the convenience of doing things at home. So it's really an emotional play. Like, what patient on earth wouldn't want that as a better experience? What parent on earth wouldn't want to take their kids somewhere and be happy? Even if they're eating poison meat, they're still happy. So I think when you're contemplating how to put together your 1 minute, how much of it, what's the balance between information and emotional storytelling has to come into your thinking when you're constructing this.
Yeah, yeah. No, I agree. You know, one of the things, John, that you know, you mentioned before that I want to emphasize again, which is the idea of really scripting this thing out. And it's something that I can't emphasize enough that people don't necessarily do. I have a lot of companies in the past who get stuck on doing their videos because they spend a ton of time shooting and not scripting. And we always tell people, don't shoot a frame, don't do anything until you've scripted this thing out. The first thing you want to do is sit down and write out. You talked, John, about like meticulously going through and cutting stuff out, you know, cutting out every word. I would script the entire thing out, script over what you're going to, you know, script out what you're going to say, the kind of messaging you want to get out there as a company, as a founder, you know, your inspiration. That was something too that I think both of these videos conveyed. The first one mentioned, you know, the inspiration for the physician, why he started this. And this one again too, they talk kind of about their mission to, you know, really to, you know, help patients and have a better experience. And so I think that really comes through. And so I think you kind of, you know, you lay out, you know, the key points, the things that you talked about earlier, John, whether it's, you know, the problem, your solution to it, you know, the message that you want to convey, the benefits for the patients, et cetera. You lay all that out in your story. You make sure you, as you just said, you have the right balance between the connection with the patient, the connection with the team, the emotion that you're trying to convey, and also the product and just the general facts you want to communicate about the company. And something that I thought was kind of amazing about this particular video is that it was 40 seconds long. It was actually 46 seconds. So the first one was 1 minute and 20 seconds. This one was 46 seconds. The first one went a little bit too long. This one was, you know, had 14 seconds that they could have used to also tell the story and maybe tell us a little more about the product. But I didn't feel like it was too short. I didn't end the video and go, wow, I wish I knew more. I did learn quite a bit. I mean, there's a couple more facts they could have thrown in, but certainly, you know, you can see how in 46 seconds, they really conveyed the story. I got to meet a patient, seeing them at home, as you said, putting the thing on, how easy that is. They just push that little button versus, you know, having their vein out and having, you know, the thing going into your vein, which all of us hate. I'm sure there's somebody on this video who says, oh, that's not a big deal, but I hate them. And so anyways, I think that, you know, as you said, it conveyed a lot in a short period of time. So I really like Tasso. I thought they did a good job with that. And, you know, and just in general, I like, again, that they kind of ended with that tagline. You know, their tagline was blood collection made simple. And, you know, that's great. The only thing, you know, that, you know, I would emphasize, as I mentioned with some more time, perhaps, is that in addition to telling us that it's blood collection made simple, I want to know, you know, a little more value to the patient than that, you know, simplicity on its own, as Janelle on our team will tell you, is not enough to get people to buy your product. It certainly helps, but simple is very important. But there's got to be some additional value that is worth too. So I think maybe whether it's in the tagline or, again, going back to the patient or whatever it might be at the end, maybe you could do that. But again, I didn't leave this video feeling like they didn't convey it. So I thought they did a good job. So that was Tasso. And any other thoughts, John?
Yes, one other thought, which is anytime and only if authentic, if you have the opportunity to personalize what inspired you to do.
Pausing there for a second, John. I think it's probably on your end. Go ahead. Yeah.
Okay, so if you can personalize it, when people say, look, my mother went through this and I was inspired to create a solution, it just really adds to your authenticity, a lean-in factor by the buyers, and something that absolutely wasn't gleaned from watching other people do things. It was really personally inspired by your story. If it applies, take advantage of that.
Great. Thank you for that. One of the things I'm going to do while I'm queuing up the next video, John, is I'm going to let people go ahead and start submitting questions. So if any of the panel, any of the attendees want to ask either John or myself a question, you can use the Q&A function at the bottom of the screen. So if you hover over, there's a Q&A icon, or you can use the chat option. Either one will work just fine. I have both of them active right now. So either one, if you want to queue up any questions for us while we're going, that will be just fine. After we watch some of these next videos, I'm going to talk a little bit about production and what's involved in terms of resources and ways in which you can do this both effectively and cost effectively at the same time. So I'll get to that in a little bit. So I'm going to go ahead, John, and if you don't mind, I'm going to play another video real quick, which also was one of the finalists in the best video competition, but as you'll see is a very different feel to it. So stand by, John. All right, hold on. So this video is from a company called Deton. And as I mentioned, as I said, these were another one of the companies that were in the finals for the best video.
Every year, millions of people suffer from lung disease, leading to 1/6 of all deaths worldwide. Doctors can't get the right information at the right time to properly treat these patients. That's not possible today because they rely on non-invasive methods that are inaccurate and unreliable, or on highly invasive methods. Deton is decoding lung health using our aerosol biopsy, a non-invasive, accurate, and reliable solution. When a patient coughs, our core platform, the cough collector, captures aerosol droplets originating in the lungs. These droplets are siphoned through a specifically designed nozzle that deposits them on a collection surface. This sample is easily integrated with standard workflows for sequencing and laboratory or point-of-care diagnostics. The total available markets in microbiome research, pneumonia, and cancer exceed $5 billion. By providing the right information at the right time, the aerosol biopsy is the key to disrupting today's treatment of lung disease.
So that's a very different video. Again,
CEO of GT Medical Technology.
And something that I think of when I watch that video is that the entire thing was animation, and so that's one of the first things that strikes me is the entire thing's animation, and the entire thing was a professional voiceover. Those are some things that strike me right away. They tell the story very well. They got a nice story. And they explain the problem kind of visually with their animation versus showing an actual patient coughing up into a cup or something that might be maybe kind of gross to see. So that was their choice, and with animation for it. But we never got to meet the team. We never really got to kind of connect, I think, in that way. That was one of the things that struck me. John, what do you think about like the team? Do you think it's important to actually physically have the people on camera and see the team? Or did you still find this to be effective?
I'm not a fan of that video. I thought it was acceptable. It was a good utility to describe the problem and specifically their solution. But as you identified, it was sterile when it comes to people and certainly sterile when it comes to emotion. Every big investment decision, believe it or not, is an emotional decision that's justified through your mind. But the decision to say, I relate to this, or I want to help, or oh my gosh, these people have a product that's going to make a difference. It's all driven by emotion. And then your brain has to sort through, okay, this makes sense. The finances make sense, the economics of the size of the market. And the video we just watched has none of the emotion. So you're really relying on the second half of the decision-making process, just thinking to carry you through. So this particular company lowered their odds on getting funded by not tapping into any emotion.
Yep. Yeah, no, I agree completely. And what did you think about the fact that they use professional voiceover through the whole thing? Do you like having professional voiceover in there, or do you think that anywhere in the video, or you like you think that it should be just the founder or the other team members or others talking?
Completely missed opportunity to have a professional voiceover person. That no one's going to buy that professional voiceover person. The message is fine, but they're going to buy the CEO or a patient or a healthcare professional explaining it to them, because those people exist within the tapestry of what you're talking about. They're part of either the solution or the problem or the team, but to have a sterile voiceover, big missed opportunity.
Yeah,
and you can talk yourself into why it's a great idea. Like, what's better than a professional VO? The answer is something someone's going to connect to emotionally. That's what's better.
Yeah, no, I agree completely. And, you know, one of the other things too that I thought, you know, is, you know, I mentioned the choice of going with animation instead of actually showing the product. I personally would much rather see a real product somewhere in the video. So it's fine having an opening animation or having an animation somewhere in the video that shows us the product and shows us maybe the problem, whatever you choose to use animation for. You can get animation these days for incredibly inexpensive amounts, which is amazing to me. You can find people who do an animation like the one we just saw for $1,000 or $2,000. But the missed opportunity is I didn't get to see the actual product. And even though I got something that kind of looked like the actual product and the final product, the risk of doing that and going all animation is that it makes me think there's no real product. And that they obviously had to just show us an animation because it's not a real product. Now, I happen to know in the case of Deton that they do have a real product. But that's just because I'm on the inside and I know. So, you know, the risk with seeing something like that is you watch it and you go, oh, that company, you know, they probably haven't gotten there yet. And they're just, you know, they're just doing an animation to give us a teaser. So that's one of my things.
I'd like to double down on that thought, Paul, because an investor or a prospective investor didn't see the actual product and never met anyone from the company.
Yep. Agreed.
It's self-defining in terms of lowering your odds.
Yeah, agreed. All right, so I'm going to go ahead and mute you again, John, and put on one last video over here. Take a look at. Stand by. The next one I'm going to show you is Ablicare.
Over 10% of women worldwide are affected by polycystic ovary syndrome, a leading cause of infertility. Unfortunately, current treatments are intense and emotionally trying, lead to serious side effects, bear very significant costs, and have a limited effectiveness. Transforming women's health and fertility care, Ablicare develops an innovative device and procedure to treat PCOS infertility. Ablicare's office-based ultrasound-guided treatment would be less costly, less risky, and less invasive than current options.
One of the advantages, it offers women a more of a physiological, natural conception rather than having to go through the multiple injections with all its risks and anxiety and frustration that patients have to go through.
At Ablicare, we are dedicated to helping millions of couples around the world facing fertility issues by providing them with a more human, respectful, and lean solution. With your support, we can make this a reality. Thank you.
So that one was one that I happen to like a lot. I think the company did a really nice job in really kind of hitting a lot of the key elements. You know, they gave us a patient and something that, you know, we saw that a little bit in the Tasso video as well. I love to see the patient. You know, I want to see the person who's affected by this. And this video started off with the patient and seeing, you know, the woman who's obviously going through a really tough time trying to get pregnant. And, you know, that emotion was extremely clear. You know, it was loud and clear. Maybe they hit us over the head really hard with it. But that's something that I really saw there. They gave us the problem, and it was in the voiceover, as we found out, of the CEO or the COO talking about the problem, telling us about the solution they've come up with. They showed us the standard of care as well. So they didn't just like Tasso, kind of showed us the venous draw, and then they went to their great arm solution instead. On the surface, the same thing here. I love that they showed kind of the standard of care, which is, you know, going through these injections and all the stress and anxiety, and then getting to a patient who, you know, who is going to have this treatment, and you see kind of the workflow that it's really just unpacking some simple equipment. Doesn't look too difficult. And then, of course, they had the credibility of having an outside person, which I thought was really great. I really liked that, although one of the things that sometimes we find in some of these videos that, you know, there's a language issue sometimes where you have someone who's foreign and it's a little hard sometimes to understand them. He was very clear, and so it wasn't a huge problem, but it is something to be aware of and to, you know, have the video shown a couple times to other people, make sure people who are really comfortable with the language can listen back to it, make sure it's clear. As I said, in this one, it was pretty much okay. I think I may have rewound it twice to make sure I got everything he said. But I loved having the expert talk about the benefit for patients, really give it some credibility. And then finally, I just love seeing the team. I love seeing Marion on camera, telling us the message, telling us the mission. It was her voice the whole way through. And it was really nice to kind of have that be the kind of mainly the cap of this, that, you know, she gave us what the opportunity was and what their mission is as a company. And she gave us a nice tagline at the end that, you know, they give us an ask, not just a tagline, but an ask. And she asked us to help. She literally said, help us, you know, help us, join us, help us in, helping improve the lives of, millions of couples kind of around the world. So, I love kind of like the whole cap for that. It was about 1 minute and 10 seconds long. And the truth is they had about 7 or 8 seconds of opening logo and ending logo, which you probably could have cut out if you really want to make it 1 minute. We're okay with them being about 1:05, usually as our guidance. So anyways, John, some of your thoughts.
I agree with everything you said. I really like the video. I like meeting a lot of the people involved with the product, and specifically, and it doesn't always apply, but having a button at the end, a call to action. You shouldn't always do that, but if you really feel like you have a connection to people through the product and the problem that you're solving, and you ask them to join you in the fight, it's a very powerful thing, or it's a very flat thing. They happened to use it at the right time, so I found it to be a very powerful, emotional touch on the shoulder of asking me to join what they're doing. But overall, I thought it was very positive. It was a different style, but it was very effective. It was a very good use of the full minute, packing in as much as they could. Excellent.
I'm going to get us to some of the questions that have been submitted by companies over here in the chat window, and try and address some of those. I know John has an out time of 11:30, so he's got about 10 more minutes to go. I will stay on after John to answer some more of the technical kinds of questions, or the more production-oriented kinds of questions. But I'm going to address a couple of these, or bring some of these up right now, to include John in some of the ones here. So one of the questions that somebody has is, what's your recommendation or approach on how to handle jargon, especially for a potentially complex product? John, what do you think about that?
I mean, it's the old tagline, keep it simple, stupid. Don't ever confuse someone in a pitch. If you have 1 minute and you're taking a turn where you're leaving someone at the first turn by using nomenclature that people are unfamiliar with, you're out of your mind. That's why you have to script this out and look at it very clearly. Every time we go out and pitch a movie or a television show, or try to hire, a producer to work on one, or an audience through marketing to watch it, we have trailers, or we have very short way to do that video-wise, and you can't leave it to chance. We never send actors into any situation without a script in their hand. That's how vital it is. You're there to read what you had days and weeks and months and years to think of. Don't blow the opportunity to be prepared.
Good answer. I like it. Here's another question, John. One of the companies asked, what if the product is software? So for example, image processing with artificial intelligence. How would you feature that versus, just the benefits? So, in the case of saying, oh, this technology is faster, better, whatever. How do you do something like that when there's, the product is software with artificial intelligence? How do you convey that visually?
Well, a good rule of thumb is you should be able to explain whatever it is you're selling or asking someone to invest in to anybody not in your industry. Meaning keeping it so simple and so digestible that anybody, whether you're at a drive-in window or a fast food restaurant or a CEO suite, should be able to understand what you're talking about. So although it may feel counterintuitive, how do you dumb down your presentation to talk about diagnostics or using AI, even if it's stick figure drawings? You want to simplify this so that the person sitting on the investing end goes, oh, I completely not only get what they do, I can explain it to somebody else. That's how simple you want your presentation. Otherwise, someone's going to think they interpret your presentation and then explain it wrong to the next person, and you've lost the opportunity.
Yeah, agreed. One of the get to a different question here. So one of the questions one of the companies asked, there's a couple people asked a similar question, which really has to do with again, the balance of rendering versus real product, and also the balance of showing the product what it looks like now versus the final version that will be sold. And I know that, you know, obviously that might be something that maybe you have to deal with as well on Shark Tank, so you can comment on that perhaps, and then I'll give you some of my thoughts as well. So I'll let you start with that, John. The current product as it states today in a stage of development versus a rendering versus, you know, the final product. How do you kind of achieve that balance?
Well, in our business, we make pilots or short videos to convince people that this is a good investment for them, if we're financing film slates or television shows. So we'll make a clip of something, and as you're making your clip, if the final product isn't ready yet, first question is, can you dress up what you currently have to look like the end product? And then explain to people, the place you're at now, you know, letter A, B, and C will finally be X, Y, Z, and this is what the product will look like. But it's very much not a generic answer. It comes down to your specific product and what it would look like if you dress it up with some bells and whistles to look like the final product. Does that create a false sense of what you're putting out there? Or will it be accurate to what it actually looks like? And how important is it to even, is that where your focus should be in this? So I find that to be a very one-off conversation depending on what the product is and what it would look like.
Yeah, no, it's a great point, John. You know, we've had companies that have achieved this by putting up a side-by-side picture. So they'll put up a picture of their current product, and they'll say, you know, currently, and they'll explain what they're developing. Currently, here's the stage. You know, here's our device. It's a brace, etc. And then next to it, they have the rendering of the finished product, and so they'll kind of put the two side by side. And you can see kind of the, you know, the unfinished versus what they conceive to be the finished version. And I think that strikes a nice balance. And again, you know, kind of the balance between, you know, animation and showing real product. I think as long as you show the real product somewhere in there, whether it's, you know, as you said, like a dressed up version that's you know, not quite there yet, but it's close. At least this gives us the sense that there's something real. I'd much rather see the product in development in a Frankenstein mess than something that's completely a rendering concept where you're like, they got nothing. So, you know, give me, at least show me something, because I know that you're a startup and that you know, you're probably not selling your finished product yet. So that's my thoughts on that. All right, let me queue up another question over here. So, so one of the questions that somebody asked was kind of, again, like this recipe question. So one of the startups said, you know, it appears that some of these good videos have the KOL, the key opinion leader, validate the need. They've got a patient to get across the emotion. They got a founder talking about the solution. Is that a good recipe? What do you think about that, John?
Yes. Well, let me explain why. You know, if I were to ask any of you, could you bake a gourmet chocolate cake? The initial response might be, I don't think so. And the truth is, the answer is yes. And what you need to be able to do that is a recipe. And if you just follow the recipe, you're going to get a pretty good cake. It may not be chef quality, but it's going to be pretty good because someone else has taken the time, thousands of times, to try different ingredients and measurements and oven temperatures and everything to figure out what works. So if you're looking at videos where there's a formula to it or certain common ingredients every time when you watch a video, and if there are things in 50 videos you watch that every single time when people do them, you're like, that works. Well, that's your recipe. So borrow the recipe and then add a pinch of salt or sugar to it to customize it to yourself. Maybe a little bit more levity, a little bit more energy, a little bit more patient focus. But don't lose sight. The reason that so many presentations, pitches revert back to the mean, meaning, wow, these in common ingredients seem to constantly work on the highest percentage. you should not ignore that. So I think recipes are very good to follow if you want to have a predictable outcome, which in this case would be someone leaning in and wanting to invest and support you.
Yeah, or following up with you in any kind of way. So what about the kind of the question about linear versus nonlinear storytelling? As we've seen in these different videos, they didn't all start with the exact same order. They didn't start with the problem, the solution, the team, you know, the ask. Some of them went in different orders. Is that something that, you know, when you talk about a recipe, does the recipe have to be the same script, the same order for everybody? Or do you think people should try and mix it up to stand out?
There's all sorts of ways to tell stories, and I'll go to the extreme, which is if you've seen the movie Memento or
backwards.
Benjamin Button, any of those movies, you can tell a story a million different ways. The question that you should be asking yourself is, what's the easiest form of storytelling for people to digest? Because that's what you want. It's not a question of really standing out and being different from the video next to you because you think that'll be a differentiator. It's how do you tell your best story? How do you tell your story in the most effective way? Generally speaking, it's a linear storytelling. People, they're listening or watching a bunch of pitches. They've got a million other personal things going on. You want to make it simple for them to understand, because in linear storytelling, it's the easiest type of storytelling to then repeat to somebody else. So if someone hears your pitch, there's a logical sequence to it that you could then go and repeat and own in terms of, okay, I got their story and I like it. Try to explain to somebody the movie Memento and you'll realize you can follow it and it's a brilliant movie. I think they did it to have specifically different storytelling. I don't know if it was effective in terms of people remembering the sequence or the order of the story it went in. So I would really stick to linear storytelling and don't overthink it. No one's asking you to write a movie or do something crazy here. You have 1 minute to tell your story. Tell it in a way that people will listen and go, I completely got it and I remember.
John, you know, we don't have much time left because you've got a hard out. So I'm just going to let you wrap up your portion of this. I'm going to keep going. What I'm going to ask you, John, maybe if, you know, kind of in closing, you could give us kind of any of your other general tips, maybe about things, whether you want to tell us things to do or things not to do. You've already told us a lot about what to do. Any advice of things not to do?
Well, when you're taping yourself, because we've already talked about that being absolutely vital. If you don't tape yourself, shame on you. You have the time and it's free. You just put your phone up to something. Be very aware of the 2-letter pitch sinker called because a lot of people, when they tape themselves, will say we have this great product and it solves this, and we have a great team working on it, and aren't even aware. When you watch a mediocre to bad speaker, I've counted, because I study pitches for a living, I've counted, you know, 25, 30 in an opening speech by someone. I can't even believe my ears. It's because they never took the time to tape themselves. Taping yourself is so valuable to watch your energy, your posture, all of your nonverbal communication, and then take that with your prepared storytelling script that you've written and wordsmithed, and you're just massively increasing your odds to have a pitch that people are going to like, remember, and that will make an impact on. So practice, practice, practice. It will improve your game.
Excellent, John. Thank you very much for that. I appreciate your taking the time. I know your time is incredibly valuable, so I appreciate your taking the time to be with us here and make yourself available and answer these questions. One of the things that we always do in MedTech Innovator is offer up some of our ecosystem to be resources and give some feedback. I know we can't have all of our companies come in and pitch you. I know they can't all come and spend an hour of their time getting feedback from you. But as we get closer to our finals and get towards the end of the process, hopefully we can tap back into a little more John Weiser time, get a little more feedback. So we'll look forward to it.
whether it was last year or the year before, the great UCLA Pitch Day, where we got to really sit and work with a lot of the entrepreneurs one-on-one or within their teams. And I love doing that. So if the invite's there and there's still a free coffee mug available, I am all over participating. And Paul, the truth is what you're doing and all of the MedTech innovators on the phone and the people that'll tune in later is so important and so cool. Like, you're really coming up with solutions that will improve the quality of life for everybody by leveraging technology and ingenuity and entrepreneurship. So to be any part of this, even if it's coaching from the sideline, happy to do it, because what's going on at MedTech Innovators is vital to improve the quality of people's lives.
Excellent, very good. I'm going to ask you one last question, John, because it's relevant specifically to you, which is, are medical technologies viable to be considered for Shark Tank?
Yes.
Excellent. Thank you for that answer. All right, John, you have a great day. Thanks for being here. We'll talk to you soon.
Thank you very much, everybody.
Thanks, John. All right, so that was tremendous to have John here. He's, as you can surmise, an amazing resource when it comes to pitching. So what I'm going to do is I'm going to answer some more of the questions that are specifically production related and related to this process that were not specific to John. So I'm going to take a little time for that, and then I'll stop the recording, and we can also have some more private discussion for people who want to talk about things that aren't on the recording. So first thing I'm going to do is just answer. I'm just going to knock through some of the questions that were submitted that are more about the this particular process. That are more specific to us. So one of the questions that was asked was, how can early stage companies achieve the level of quality that we see on these videos, showing the device, the real patient, things like that. And I think, it's incredibly easy to use resources like your cell phone to shoot these videos. You can have 4K video off of a phone now. So, quality-wise, you don't need to have professional equipment, although you can go out and buy a Canon or something that is semi-professional. That's what all of our videographers use, and they're not that expensive, or have someone who will lend one to you. So in terms of quality, that's the first thing. There's no excuse to not have, high-quality video. And so then there's the question about, like, showing the device, showing a real patient. Again, I highly advocate getting over to a hospital, getting over to a clinic, getting over someplace, as long as if you have that kind of access, and letting them, actually let you actually shoot a patient in their real context, or the caregiver. But if you don't have that option, the other option is stock footage. And many of our companies, and many of the videos that you've seen and that you will see if you were to go through that page on our website, use stock footage, and they use it reliably and repeatedly. The video looks great. You can go onto websites like Adobe, and you can search their video assets, and you can even go to YouTube and search for a very specific term or phrase, and probably find a video showing it in action without ever going to a hospital, ever going anywhere else. You can shoot that video. I mean, you can find that video. You can download it. In most cases, if it's what's called Creative Commons, you can use it for free. Or if you have to get a license to it, it might cost you $15 or something. But that's definitely a resource that I would recommend people take advantage of, is all the stock footage that's out there. So that's another opportunity. Another question that that somebody asked was about getting it done on a conservative budget. So budget, for these videos, I can tell you, and you can talk to our alumni, these things cost people anything from zero, like they spent $0 and have some of the kind of video you've been watching, to companies spending $10,000. It all depends on what their comfort is in terms of shooting video, editing video, making an animation, and so on. Usually in your ecosystem somewhere, there's somebody who might be willing to give you a free resource for either shooting video, for helping to edit in some cases. You might have kids who are very good at that, or friends' kids who are good at that. We've always found that to be a resource, that people come in and willing to just sit there on iMovie and help you edit together a video. There's all sorts of great resources out there that are completely free. The stuff that's not free is if you want to, hire a professional actor, which I don't think you need to. One of our finalists last year had their wife in the video as the patient. and so on. So you always have the opportunity just to use, friends and family in these videos. Also, the other thing that you can do, the thing that would cost money would be if you are paying for, as I said, more professional gear. So one of the teams had a dolly that they rented that, that kind of slid along a track. I've also found dollies that you can buy online for like $15 and put on like, a small camera. So it just depends on your creativity. In the same way you're creative in putting together your products, you can be creative about approaching this. But as I said, there's usually somebody in your ecosystem that's good at making videos. And if you put the word out now, when you still got way over a month to go, you've got plenty of time to reach out to your network and say, hey, I got to produce this video. It's due in a month, a little over a month. Is there somebody who's really good at making videos that could help me out, for free? And usually you can find at least somebody who's willing to do that. Another question somebody asked was, again, related to this, recording the video, do you need a professional company for that? They look very professional. I don't think any of the videos we watched had a professional crew shooting the video. There are some videos in our program, if you look at our archives, where they have had a professional crew come in, but it's not necessary. Usually there's someone on your staff, somebody on your team, someone in your ecosystem that's good at shooting video. And as I said, it might be your kids, it might be your friends' kids as well. Find a summer intern and say, hey, we got to make a video. We've only got a month to do it. Can you come in once a week and, start off, making the script, and we'll work on that together. And then maybe next week we'll, after we've had a chance to get feedback on the script, we'll actually kind of lay out like, the shots we plan to actually shoot. And then the next week you can actually go shoot it. And that shooting usually for these videos is a day at most, or a couple different sessions over a couple days. And then after that, it's editing. And editing is probably the toughest part, because now you got to decide what to throw out. You're like, oh, I love that shot, but now I got to throw that out for the sake of time. I really want to squeeze that in. That's where you edit together your video as best you can. It's 1 minute and 45 seconds when you start, and then you start to trim it and figure out what you can throw out. Another question somebody asked was about targeting this to investors. So someone said, lots of talk about targeting this to investors, but my understanding is this being shown to the industry. Who should be targeting the video to? So the audience for this video should be considered anybody who you might want to be showing the video to someday. In the particular short-term use case, we're going to have a video competition that's going to lead up to the conference. So we're going to be putting these on YouTube. You're going to be able to put those out for people to see and vote and watch and like to vote for them. We're also going to be having these go to our industry panel of people to review at our selection committee, and they're going to weigh in on votes. And then we're going to narrow down to 5 finalists, and then those are going to be shown live at the conference, and people are going to vote live. And now at the conference for the voting competition, again, that's anybody who's in the audience. So that will be a mix of people who are industry, probably maybe all industry in the audience, but maybe they don't know your technology or their area of that your technology is not in their area of expertise. So just try and address this to kind of the lay audience is what you're ultimately hoping to convince. As John said, even experts will struggle to know every single disease and every competing technology and everything else. So you're better just kind of being simple and telling the story as simply as you can. Obviously, you can use the real name for the disease, but if it's complex, try and simplify it a bit. This video should be something that you could comfortably put on your website without having to explain what you do to anybody in terms of the real technical knowledge set, and they should be able to understand generally what you're trying to do. So I would, as John kept using the word investor, I do too a lot, because that's who we're thinking of. Ultimately, you guys have got to raise money and get to your next milestones. So investors are very important to be thinking about this. But I can tell you, as an investor who looks at 1,000 opportunities in a year, I don't know everything about every technology. I know a lot. I know a little about a lot, but I don't know everything about everything. So I would definitely target this to kind of a middle audience. Or even, as I said, towards the lay audience of people who really just shouldn't have to know anything about your technology. You should be able to show this video to your grandmother, to your parents, to your friends who know nothing about your business, and they should be able to understand the problem, the solution to the problem, the key messaging, and kind of have that emotional connection. You want them to finish the video and go, God, I really felt for the patient. I really felt for the for the mom who had to be there, you know, during that blood draw with her daughter or whatever you show. So I definitely shoot for, as I said, kind of the lay audience there. But of course, give us enough to show us that you're credible. That's important too. So that's very important. Another question that somebody asked was, is the form, you know, any particular format for the video? So we're going to be sending out a follow-up email with more details about the exact specifications in terms of the frames per second and all that kind of stuff, which we will send. Also, is where to upload the videos, we will send that as well. Other last things I think we can address then, maybe from the overall thing here in terms of the overall aspects that we're shooting for in terms of general aspects and things to think about, is that number one, we want to make sure that people find these videos memorable. If somebody has to rewind your video and watch it twice in order to get to the key takeaways, you've missed something. You've made a mistake. The video should not have to be rewound to understand the video. As I mentioned before, if you have someone who's a little hard to understand because of their accent, you can put subtitles on there and no one's going to be offended. You can certainly do that. I find in some of the videos that we played, you know, if there's a long animation, but there's key stats being mentioned verbally that you want people to remember, put them up on the screen in a huge font. I'm a big fan of huge fonts. And if it says, you know, 3 million people a year have, you know, this particular problem, I want to see the number 3 million up on the year, on the, you know, 3 million on the screen. If the statistic is about the number of patients, I want to know that there's 500,000 patients. I want to see 500,000 patients. Just put that up there. You don't have to put all the text. You don't have to have all the bullets. You could just have 500,000 patients. Just something you want me to remember. Whatever it is you want me to remember, make sure I remember it. Make sure people who watch your video afterwards, you say, what do you remember about this video? That is super important. Also, make sure that, as I said before, that when you script this thing, you don't just script it and then start shooting. Take the script, give it to other people, let them read the script, make sure they understand, describe kind of what you're planning on shooting if there's footage. Say, you know, we're going to open this up with a shot of the patient in a wheelchair as they kind of leave the hospital, and then, you know, and have what the voiceover is going to say. Just describe, kind of script out what this thing should be. Really think of it that way. The other thing that John mentioned that I also would emphasize is deconstruct other videos. So go to our website. You have plenty of time now. Go under the Showcase tab. Look at where it says in the nav bar, Showcase Videos. You can see all the ones from the past 7 years, but look at just this last crop of videos. Go through them, kind of deconstruct them, take notes on the ones that you believe you found to really be effective, and write down, what do they do? Oh, problem, solution, team, ask, whatever it is at the end. You know, the team saying welcome at the end, or please join us, whatever it might be. Deconstruct, give us all those resources. And the most important tip I will give you is do not just be a talking head on a screen. That is something that is something that is just a complete and total no-no. Don't come on the screen and just have your head on the screen for 60 seconds talking about the problem. I know some people might be tempted to do that, but it's something that will be not well received. As John said about Memento, the movie that was shot backwards, it's memorable that they shot it backwards, but it's very hard to follow. So that is not something I would do. I would not take a risk in that way and say, I'm going to be different and I'm just going to be me on the screen the whole way. I would not do that personally. Other last tip would be don't rush. Something that people can be tempted to do is to say, well, I've only got a minute, so I'm going to rush through what I have to say. Don't do that. I would definitely take your time. One of the videos I didn't get a chance to show today is from a company called SPECT. I highly recommend watching the SPECT video. It's a tremendous video in general, so it would have been the next one I was going to show. But what they do very well is the CEO, Ankur, speaks slowly. And he's somebody who was trained at Y Combinator, where they teach you to speak slowly. And he does it very well in this video. As he's opening up and he's talking, he's very deliberately speaking slow about the problem and about their solution. And there's an effectiveness to it. So it doesn't feel rushed at all. It turns a 1-minute video into something that feels more like 2 minutes, having that pacing. So I think that's really important. The last tip I'll give you, and we're at a minute, or an hour and 15, so I have to wrap up. The last tips I'll give you is, in addition to our website as a resource, AdvaMed also has a website that you can get to from their main website. So if you go to advamed.org, you'll see a link to what they call lifechanginginnovation.org. And that's a website that has patient stories, medical device industry stories, and very short videos in some cases that tell a story very deliberately about the medical device industry helping to save lives. There's a formula to it. These things were highly produced and they were paid for. They had professional companies shoot and produce them. You can learn a lot from that. So I would watch those videos. They're usually like 30 seconds long, and use that as a resource. So it's lifechanginginnovation.org, which you can get to from advamed.org. Besides that, I'll close by saying that this was a tremendous webinar. I love talking to John. He's an amazing resource and somebody who, as I mentioned, is an incredible salesperson as well. He's got great tips in general just on how to connect with people. So encourage you to definitely take advantage of his offer to reach out at some point, not tomorrow, but later on when you start maybe getting into more of producing your video. If you want to email us and ask for an intro, be happy to make that intro. So with that, I'm just going to let you know again that we'll have our next webinar will be on negotiating term sheets and just the kind of the process in general of deal terms, something that a lot of you are out raising money and you should be thinking about early in the process if you aren't already. So we're going to have Casey McGlynn from Wilson Sonsini will be on that to talk about term sheets, and we'll also have at least one investor as well joining him, although he's an investor himself. So we'll be talking about negotiating in term sheets and deal terms and getting into some of the nitty-gritty on that, which will be very different than videos today. As I mentioned, the video deadline is in August 19th. We want to make sure that you take the time to produce these videos. Email us with questions. We'll follow up and get back to you and answer your questions. So that's it for today. Thank you for joining us. Go to medtechinnovator.org/live to see our webinars, to see the schedule for upcoming webinars, and look forward to talking to you all soon. Thank you very much.